Welcome to the Champions of Active Women podcast. In this podcast, we will interview individuals who have been successful within athletics and beyond. We hope that these interviews will encourage and inspire girls and women to be active for a lifetime, to reach their goals, and to break new barriers in sport and life. This podcast is brought to you by the Active Women's Health Initiative and the Sports Medicine Research Institute at the University of Kentucky. The mission of the Active Women's Health Initiative is to optimize health and promote physical activity and wellness for girls and women across the lifespan. We hope you enjoy our conversations and join us in understanding women's health today to ensure women's health tomorrow. Hi, I'm Dee Dugonski. Thank you for joining me for another episode of the Champions of Active Women podcast. Today, my guest is Jody Ensman. Jody is the program manager of University of Kentucky Health and Wellness, where she has worked since 2003. Prior to joining UK, she worked in a number of key management positions with responsibility for design and administration of health promotion and fitness programs for leading global corporations, including Johnson & Johnson Healthcare Systems, Owens Corning World Headquarters, Ford, and General Motors. Jody holds a Bachelor of Science degree in Health and Physical Education from Edinboro University of Pennsylvania, where she was also a multi-sport athlete. Jody earned a Master of Science degree in Kinesiology and Health Promotion, with an emphasis in corporate wellness from the University of Kentucky. She's a passionate advocate for living a healthy lifestyle, and I'm looking forward to our conversation. Welcome, Jody.
Thank you.
So thanks for joining me today, and to get us started, I thought you could just share what you think health means to you.
Absolutely. Yeah, so health. Let's see. You know, if you check out the dictionary and you look up the term health, it's primarily the absence of disease. However, my philosophy or my definition really incorporates the whole person. So it would not necessarily be the absence of disease, but it would be that you are thriving in various areas of the whole person. So whether that be mind, body, spirit, or physical health, mental health, spiritual health, I think is how I would define health. It's more of a well-being, whole person type of definition.
Good. So a very holistic
Absolutely.
approach and thought to health. So can you talk about your early life sport and physical activity experiences?
Sure. Yeah, so I was fortunate enough to grow up in a fairly large family of 6 children, and I was the youngest. So therefore, I had 5 siblings who I was drugged to all of their sporting events. And we also grew up in a time where being physically active and being outdoors was the norm. And so we were actually summoned to come in before dark by a dinner bell. So we would be out being physically active and all the time playing with neighborhood kids, whether it be kick the can or baseball or what have you. But more structured physical activity kind of came into play when early on when I signed up for a swim team when I was like 9 or 10. And then it evolved into softball. And then in high school, I was a 3-sport athlete where it was a focus on basketball, volleyball, and softball too. So it was something that's all I knew. I didn't really know anything different. It was just part of our life as a family, and then it became part of my life as a child.
Yeah, were your parents active with you as well?
You know, I think their activity level, to be honest, was just trying to keep up with the 6 of us.
Yeah, I can imagine.
Yeah, so as far as a structured exercise, not so much, but they definitely did value the fact that us kids were active.
Mm-hmm. So thinking about organized sports then, can you tell me about how you think sports impacted your education and maybe how that transition went from high school into college athletics?
Yeah, so I was fortunate enough to be able to receive an education by way of a scholarship for participating in volleyball and basketball in college. And I feel like that opportunity had led me to experience some leadership skills and team-oriented type of strategies and goal setting that kind of led me into the field of what I'm in now is health. I just feel like it was such a part of who I am, and I didn't know anything different. And so it was just something that I felt was important to me, and how could I incorporate that into other people's lives?
Mm-hmm. Can you talk a little bit about what the experience was like being a a collegiate athlete and then transitioning that into your lifestyle physical activity?
Yeah. So again, it being just a part of who I was, I didn't know anything different. And, once I graduated, it was, was not that formal type of team environment. Mm-hmm. And so unless you could seek that out if you did, but I just didn't have that opportunity to seek it out right when I graduated. So because it was such an important part of my life, I then decided to kind of take it to an individual level where I started dabbling in triathlon. So that transition from a team sport, athletics, kind of transitioned into more of an individual goal setting in competing in triathlon. So that transition was fairly easy, but then it was the transition from being a triathlete to physical activity as a part of my daily life was actually, it kind of happened organically. It was, okay, my body, I'm starting to feel the impact of all the years of competition, but yet I was at a space emotionally and mentally that, it's okay not to be so competitive, and whether it be against a team or against myself. And so that's when I started to incorporate just general physical activity into my daily lives.
Yeah. So going from a competitive athlete to then a triathlete and now thinking about your lifestyle physical activity, what kind of activities do you enjoy doing now?
Yeah, absolutely. So right now, I very much enjoy the outdoors. So I will choose activities that are out in nature, whether that just be walking my dog. I do stand-up paddling. I happen to do that with my dog as well. Hiking is one of my favorites. There's a lot of great trails, even in this local Lexington area. Right. You've got the Red River Gorge just down the way, so they're easy to find. So hiking has really become more of a passion in years past as well. Mm-hmm.
I think I was surprised when we had our phone call before this interview, and you said you really don't like being in the gym, and I think that surprised me as someone who is in your field. Do you get that often, or?
Yeah, right. I think I'm an anomaly like that. It's one that where I think I thrive the most is out in nature, and that's okay because there are some people who love the gym, and that's okay too. I think it's one of those things where you have to choose something that you know that you're going to enjoy doing. And if you don't enjoy doing it, then you won't do it. So I feel like the fact that, I am in this field of corporate wellness and fitness, but, I choose not to necessarily be in the gym might show others that you don't have to. Yeah. And so that the gym may not be for everyone.
Yeah, and I love that perspective because it's really not for everyone. I mean, there are
Absolutely
some people who,
not.
and I always tell people, like, if Zumba is the only way I had to be active, I would be the most inactive person because I don't enjoy it. And it's
That's
that
right.
same principle.
That's right. Absolutely.
Good. So can you talk about what the biggest challenge was that you had in transitioning from competitive athletics to lifetime physical activity?
The biggest challenge, let's see. For me, I think it went from exercising and being physically active with a lot of people to being active by myself or with my dog. I think really that was it. I think the fact that I just had to make it be intentional a little bit more so than I did when I was a competitive athlete. That was the expectation. It was that you competed. Well, now I have to be a little bit more intentional about that, about making sure that it is incorporated into my life. But it's easy for me because I enjoy that. So,
good. So earlier you mentioned having your career and your career path may have been determined by who you are as a person and the fact that you've been active your whole life. So could you talk a little bit about how your experiences within athletics, you've had lots of leadership roles, and how maybe in your career, those experiences in athletics and being active, how that shaped your leadership style?
Yeah, absolutely. So it was interesting as a collegiate athlete, or even prior to that, is that I found out fairly early that I was was a leader as a part of the team. So it felt like a natural position for me to be, whether it be a team captain or just a leader of the team. So I feel like those skills that were enhanced as a team captain or as a part of a team have actually helped me be a leader within the industry of corporate wellness. Those skills you very much carry over. There's a lot of parallels, I feel like, between athletics and leadership. And, I also feel like the concepts of a team, I manage a wellness team here. So those similar principles related back to my athletic teams where, our team is only as strong as its weakest link, right? So we together as a team have to set goals and encourage others to be their best in order for the team or the unit to be at their best. So I feel like those types of strategies have really helped me in my role here with UK Health and Wellness in leading the health and wellness team.
Yeah. And as part of that team, you're kind of have a front row seat to health challenges and the solutions to some of those challenges. So could you talk a little bit about what you see as our biggest challenges as individuals, as a university community, as the Lexington community, and maybe wider than that in maintaining health?
Right. So, challenges. Well, there are many challenges, but what I feel like is happening is, over the past decade, life has just become very busy. And as far as the individual is concerned, there are very blurred lines now between your home life and your work life. And a lot of times you bring your home life to work and your work life to home, and it's not real black and white anymore. And then you've got you're caring for children, and a lot of times not only are you caring for children, you might be caring for elderly parents. And so what we're seeing is that there's just a lot of busyness going on that is, it's just part of life. That's the way life has transitioned right now. And so I think that is a challenge, not only from an individual standpoint, but from a university standpoint too, because, as a university community, we bring sometimes our home life into our work. And so I think what the solutions might be is by being intentional, both from an individual standpoint but also from a university standpoint. From a university standpoint, the fact that we have a health and wellness program specific for employees is very intentional in a sense that UK does care about the well-being of their employees. They're intentional for having a unit specifically dedicated to improving the well-being of their employees' lives. So I feel like being intentional is really critical in incorporating that from a university's perspective, and then in an individual's perspective. Being healthy is not the easy choice right now.
It's not, for sure. In any kind of health you're talking about.
That's right. It's just not an easy choice because fast food is not necessarily obviously a healthy choice, but it's the easiest choice. Vending machines, it's an easy unhealthy choice. And so I think, again, it's bringing it back to intention. You have to really intentionally bring it into your life and see how it can fit and then begin to live it out.
Yeah. What are some positive examples, things you're seeing within your department or on campus or in the community that kind of make you think that it's possible to live differently, to live more intentionally?
Oh, that's a really good question. Just an example, I don't know if this really answers that question, but there was an initiative that we rolled out here on campus regarding fitness wearables. And I think with the emphasis on physical activity and that, it requires just being intentional about how many steps an individual gets in their day. And I think what has happened, at least on the university side of things, is that it's now becoming a part of their life at work, and they're talking with colleagues about how many steps did you get today, or they're incorporating walking meetings to make sure that they get their steps throughout the day. So I think that's something. There's a bit of a shift of, okay, it doesn't have to be I go to the gym. but they're at least intentional about, okay, maybe I'm getting a few extra steps today by the encouragement of a fitness wearable.
So as you think about specifically people, but specifically girls and women, what kind of messages or advice do you have for girls and women who are trying to increase their physical activity or just be healthier in general?
Yeah, that's a good question. So I guess the advice that I would give is that really, truly think about what it is that you would enjoy doing. I think I alluded to this earlier in the fact that if you don't enjoy walking on a treadmill, what is it that you do enjoy? Do you enjoy playing with your grandchildren? Do you enjoy playing with your children? If that's the case, then be active with them. Mm-hmm. So finding what is going to what you're going to enjoy, incorporate that into your life. I mean, it sounds pretty simple, but I really think that is foundational because we tend to engage in activities that we enjoy. So find something. And I think that once you begin to become more physically active, they will begin to feel much better. And so that they might equate that the way they feel with physical activity, and then it will just be a part of their life, I feel like.
Did you ever have challenges finding something you enjoyed? I mean, did you try things that you didn't like? Because lots of people give this advice, right? Like find something you enjoy. And I worry that some people might try something and not like it and feel like there's not that thing out there for them.
Being discouraged or whatnot. Well, you know what I find, and I'm going to plug a resource that we have through UK Health and Wellness. Okay. We have exercise specialists and we also have health coaches that can do that exact thing, is to help you women find what it is that they enjoy. They may not realize all that's available to them in the community or simple activities inside the home or outside the home. So I feel like talking to someone whether it be a health coach or an exercise specialist that we have within the health and wellness program, they can talk through those types of things and then try it. And if you don't like it, there might be something else out. So let's try to figure that out together. So I think that's a nice resource that we offer that can help women in general determine what that might be for them. Yeah,
just keep trying until you find
that's
something.
Right.
And that's hard sometimes, right?
If
you find some things you don't like first, then it's
you
hard
get
to
discouraged,
keep going,
right?
But I think that's good advice for sure. So if you think back over your lifetime and the activity and just everything you've done in your life, how would your life be different if you weren't as active as you have been throughout your life?
Oh, goodness. I don't even know that I would like to think about what it would be like without, I don't know. I think it's such a part of who I am that I can't separate it out. So it's very hard for me to answer that question. I'm sorry. It might sound ridiculous, but I feel like it's such a part of my life and that I find a lot of joy in it. And it does help me thrive in my life. So, yeah.
What else would you like to share with our audience today about being active or being healthy?
I feel like the advice I would give is for women or young girls is that just give it a try. I think that you will find that you will reap many benefits that you didn't even think that you could reap from being physically active.
Well, I thank you so much for your time today, Jody, and I appreciate the time you spent and the advice that you've given to our audience.
Excellent. Thank you.
Thank you for listening to the Champions of Active Women podcast. This podcast is brought to you by the Active Women's Health Initiative and was produced by the Faculty Media Depot at the University of Kentucky. If you enjoyed this episode, you can listen and subscribe to all of our episodes wherever you find your podcasts. For up-to-date information about the Active Women's Health Initiative, you can find us on social media at UKAWHI. Thank you for supporting us as we work to promote health and physical activity among girls and women across the lifespan.